In breast cancer, we have so many research ongoing in radiation, of course in chemo and surgery as well. But for the radiation part, the major change and shift is what we call de-escalation, moving from, I'm talking about radiation only, moving from the 6 week of radiation on daily radiation. Now we are moving into 3 weeks with the hypofractionation, 1 week with the partial breast radiation, 1 day with the intra-op radiation, or no radiation at all. So these are the most important changes that are ongoing in breast cancer. The challenge, though, is to find out who are the patients who would be eligible for each one of those. So this is where the focus of the research right now. And the discussion in the session was around the hypofractionation, or the 3-week regimen, how to use it, who could benefit from it, and if we can extend it to patients who have advanced cancers, not only the small and early stage cancers. So we discussed that. The second point is discussion of the partial breast radiation technique and update on the latest trials, and also discussion of the cases when we can avoid radiation therapy. In the past, we used to give for everybody, but now as we understand the biology and the natural history of some molecular types of breast cancer, we realized that all cancers are not the same, and some of them could actually go without the use of radiation to avoid the toxicity of radiation. And as we understand more now about the biology and the molecular profiles of these tumors, then we really can make a decision for patients and avoid the unnecessary treatment. Anytime we can limit the treatment and retrieve the same level of cure, it's a benefit for the patient. In a hypofractionated regimen, all studies have shown that you decrease acute toxicity, which is the skin reactions mainly and the pain that the patient experienced during radiation. So this is very well proven that we have decrease in acute reactions. And in some studies, there is improvement in cosmesis in the late effects. Not all studies, though. And one study, actually the largest study, has shown actually benefit on survival. We don't know how and why, but it is actually in the START UK trial where there is a benefit on survival. It has not been duplicated in other studies. There are no similar studies ongoing. There are no studies going to improve on the de-escalation in time. The current UK study that they call it Fast Forward is actually a combination of hypofractionation, lower dose per fraction, and a decrease in time. And now instead of 3 weeks, we are moving to 1 week, but treating the entire breast with 27 gray, which is quite a bit of a dose, but over 1 week. And I think this is a quite provocative design to see if we can compress all treatment in 5 sessions. And they have completed what we call the pilot or phase 2 study to see if feasible, not toxic, and they published no excessive toxicity, and now the phase 3 comparative trial is ongoing. So we are moving in this direction. At the same time, we are moving in the direction of the partial breast radiation, where we are treating only the site of the tumor in some low-risk patients. The very important topic that I discussed also at the end of my presentation was the importance of a very simple technique called deep inspiration breast hold to separate the heart from the chest wall and improve the toxicity of radiation vis-a-vis the heart by pushing the heart away. And I urge the audience to practice this technique and to acquire this technique, which is not very expensive, just to improve on the tolerance of radiation therapy for breast cancer, specifically for left-sided tumor, because it's not allowed nowadays to still deliver incidental radiation to the heart because we can technically avoid it.